Vidyafy.
Educate,
support,
empower.
Welcome to Vidyafy. So this is our second episode of our speaker series session, and we have another amazing speaker with us, which is Dr. Manu Chaudhary with us, who has achieved so much in her life. She has cleared AFMC college, and she is currently a pediatrician. So if I'll introduce more about her, I'll take a minute or two to introduce her. So I'll ask Dr. Manu Chaudhary only to introduce herself. So welcome, Dr. Manu Chaudhary.
Thanks, Kashish. Thanks, Karan. Thanks for having me here. I'm Dr. Manu Chaudhary. So I am a pediatrician and a pediatric infectious diseases specialist working at Rainbow Children's Hospital, Marathali, Bangalore, India.
Thank you so much. So I'll first explain you about our speaker series format. Like we will be asking you a few sets of questions, which will be more regarding your journey, starting from your school life then to your college. So how did you face lots of challenges and difficulties in your career journey, and how you have tackled it? Like what solutions you implemented on that. So yeah, tell us about which location do you belong to? How was when did you started your journey, from where, and currently where are you working right now?
Sure. So I'm from Delhi. That's where I was born. Then I went to, most of my family was going to sports school. So I went to Haryana, Motilal Nehru School of Sports, Rai. Came back to Delhi, did my 9th to 12th grade there in St. Francis School, Janakpuri. Then I went to FMC Pune, which was my medical school. I got an opportunity to do some clinical rotations in US, in Harvard. So I really liked the system, and I liked the system that you basically interview in the subject you're interested in. So I loved kids. So I wanted to be a pediatrician. So I then went through the process of United States medical licensing examinations. I did my pediatric training, 3 years of training there in US, followed by 3 years of super specialization, which I think in India they call it DM, in pediatric infections. And I finished that up due to my, my significant other. I had to return to India. So then I came back, finishing my training. And I've been here in India for 3 years now. And currently I am positioned in Bangalore, where I'm part of one of the largest pediatric chains of hospital in India. My hospital is 300 bedded pediatric hospital, where I'm practicing as a pediatrician, as well as I'm doing special work with infections, pediatric infections.
That's great. So tell us about how your typical day work look like right now.
Sure. So I usually I chose a stream where I didn't want to do overnight work. I think I just wanted to go in the daytime, be there, provide whole care, and come back home. So currently my day, I get up around 7, be at work by 8:30. Usually it starts with the me rounding on my patients, so checking my patients in ICUs and in wards. Then I'll have my OPD, where I'll see patients coming to our OPDs. In between, I'll probably get calls from different consultants in different areas of the hospital to see their patients related to infections. It also, I am currently, because of the COVID scenario, I am leading a COVID task force for my hospital, where I'm making protocols and then executing them. So I'm leading that task force. So that also takes my time during the day, where we are meeting and discussing and then running simulations. And then there are a lot of DNB residents, so like trainees in pediatrics who are in our hospital. So I take active efforts to. I'm a clinical educator, so I do their conferences, their lectures series, and all. So probably some part of my day is dedicated to that. And then I'm back by 5:30, 6:30, depending on how the patient load is, if I get more patients to see. Yeah, so that's my typical day. And
You're
you,
already contributing a lot to the society in this COVID time.
thank you. It's Monday to Saturday, I'm working, and then Sunday is a off day. Yeah, it's pretty much my day.
Thank you, Dr. Manu. So we know a bit about your current schedule, your career journey. We want to dig deeper into how your student life was. So just give a brief about, I know like I have personally watched your school life, but I still want to know like from a first person perspective, like did you always knew that okay you have to become a doctor? Did you face some uncertainties? Because even right now like I'm doing my master's too, and Kashish is already his job, still we have some uncertainties of where we want to go, and we want to address those uncertainties. That having those uncertainties is very natural. So just take us back to your student life when you face those uncertainties and how you catered to those uncertainties.
Sure, sure. So for all the viewers, Karandeep is my brother, younger brother. So yes, did I know I wanted to be a doctor early on in my life? No, not really. So my elder sister was doing engineering, so I was fascinated, and that's what I wanted to do, engineering. But I think and with most of the parents at that point of time, just like any other parent, my father suggested taking both maths and biology. So that's what I did. And most of my process during life has been by elimination, what I don't like. Okay, so
Okay.
so I didn't enjoy computers that much, or I enjoyed maths, but not to the extent that this is what I want to do rest of my life. But I was very fascinated by biology, so that kind of like moved me towards, okay, why not try this? And what I realized during my school years was I really enjoy human interactions. So I
Okay.
wanted to be in a profession where I will get to interact with other humans on daily basis. And I think at my time, which is 13, 14 years ago, I think the two big professions were you either be an engineer or you become a doctor. So I
Right.
was like, I think I want to be a doctor. So that's how like I went into, like, I did all the entrance. I took entrance exams for even engineering, but fortunately I got into AFMC, which where because I came from a sports background. So when I interviewed at AFMC, I saw their tennis court, and I was like, this is where I want to go. Because in India, because in India, it's basically once you're in medical education, you're like, your life is like just studies. So I was like, I don't want to have that kind of life. So that kind of took me to AFMC Pune. And then when I was in my fourth year, that's where you have most of your clinical rotations, third and fourth year of your med school. So, and that's when you kind of decide what kind of further education you want to take. So that during that fourth year, I had a very wonderful physician, Dr. Madhuri Kanatkar, who is now a
Okay.
DGFS, very, very well-known personality in India. She was my head of the department for pediatrics, and I just loved the way she practiced, how she interacted
Okay.
with children, and how children responded to, a physician. So I think and that was like, I always loved kids, even like you can vouch for me, Karan, but I really loved interacting with kids. So I was like, this would be amazing. So, rest of my life, I could wake up, go to a place where I can be with these lovely souls and innocent souls. So that's how I picked up pediatrics. And then, I think I was like, it wasn't like I was very uncertain every time. It was basically
Okay.
things just unfolded gradually. And that's what's the message for people also. Like, you don't have to know, like, what do you want to be in 20 years. I think just take your life as it comes. Of course, you need to have some idea, because then you take your exams accordingly. So that's what I did. I had quite some guidance during this time from my family, from my friends, from my seniors. And then what took me to US was, as I said, like in India entrance exam, you have a common entrance exam, and based on your merit, you get to choose your stream. So you might not get
Yeah.
what you really want. So
Correct.
Right.
so that's, and in US you take these USMLE exams, which are like set of 3 exams. Step 1, step 2 has 2 exams, one clinical and then again one MCQs, and it's like a long exam, so you really have to prepare for it. And then you have step 3, and then you interview you apply to different hospitals in US, and then you interview, and then you go there, and based on your, you rank the hospital ranks you, and by matching system you then get your residency. And then once I got into residency, I really enjoyed the recovery aspect of infectious diseases. So, you give
Okay.
treatment, you see response, and your patient go home. Whereas, cancer, you might lose your patients, and then there are chronic diseases like, kidney or heart diseases, which are like a lifelong sentence. So, that would make me very emotional about my patients. So I was
Okay.
like, okay, I want to do something which is, I give some treatment and you see cure and your patient goes happy, and they
Okay.
come down but they leave happily. So and that was my further training. And then I told you it was my husband, because of who I came back to India. Yeah. So
So
that's
thank you for such a great background about your student journey. So you are one of the speakers who have experienced the education system in India and then in some other country. So for you, like what differences did you see? Did you see like the students in India, they were more focused or less focused? How do you compare the how students think and then how system supports them? Like if you can just give those two
sure,
views.
sure. So what I felt, one of the biggest difference was the student teacher ratio. So they have
Okay.
brilliant students. Here we
Mhm.
have like more number of children and then less number of teachers. Second is the age gap. So when I entered residency there, I was one of the youngest there. Okay, so
Okay.
we probably do like 16 or 17. By 17, we are in the college. But there
Mhm.
they have a longer duration of their medical education, and then some people change from engineering to medicine, so they might even have children. So I think the other thing was they are older and they really know that's what they want to do. Because
Okay.
I remember from med school, some of my colleagues went into wildlife photography because medicine was
Hmm.
not something they wanted to do. Well, once they were like 21
Okay.
and they were like, "Okay, where am I?" So realization of what you really want to do for rest of your life, they have more realization. And then resources, I think they had amazing online resources for their students. So lot of hands on. I think sincerity
Hmm.
wise, both places, I think medical students work really hard. I think it
Okay.
was very dedicated med students there as well as here. I would say more opportunities were available there,
Okay.
but you have more access to more patients here because
Okay.
because of the population we have.
Okay. And as a student, like if you go back to your student life, you said like when you were in college, when you were in AFMC, you knew like you want to interact with children and pediatrics is the way forward. But if you go to your student life, if you had more knowledge about all different career paths, like you said, you just knew about doctor, engineer. Say if you knew about 5 more paths, so would you be doing something else today, or would you still stick to being a doctor?
I think I would still be a doctor. I just love my
Okay.
job. I think it's very gratifying. Yeah.
Okay.
I wanted to be an actress when I was in med school. So there was, so we were in Pune, right? It's very close to
Mhm,
Bollywood, Bombay.
mhm.
So we would have lot of these celebrities come and do what are this called? The first show thing. So they would come there.
Okay.
So I would look at them. I was like, I am better looking than this person. I can totally do it. I was very actively involved in dramatics and dance in my med school, and then we used to have our fests. So it's not like medicine doesn't mean like, oh my god, these are like super studious people. We had
Okay.
our lot of fun in med school. Like I'm telling you, it's the best I've had ever in my life. So we had our fest, and we had a fashion show, and I think one of the person was from Bollywood who was our judge, and they approached
Okay.
two of us to come and do some runway shows for them in Mumbai.
Wow.
And I was like off cloud number 9. I was but then of course you have to choose what you want to do, and it's a very strict disciplinarian institute, so you can't just go like and do runway shows anywhere else. But
Okay.
yeah, I've had my share of fun in college.
Yeah, that's great. Like at least you choose one another option in the career as well. Yeah.
Yeah, it was funny because I literally called my elder sister. I was like, I think I want to be an actress. I don't want to be a doctor. Just shut up and study. Focus. But yeah,
That's
I
it.
would actually still be a physician.
Yeah. Okay, let me take you to a separate topic right now. So tell us about like if this career which you are following right now, if this career would have been like pursued by specially abled people, like what all things, like if you have experienced in your career, like what all things it could be like possible, like is it possible for them to achieve a stable career in being a doctor, being a pediatrician?
Absolutely. I think it can very well be achieved because that's one thing I noticed in US. They are
Mm-hmm.
very inclusive society. So
Uh-huh.
I had a physician who basically was short stature, really short stature, which we call dwarfs, and she was our leading neonatologist, so like a newborn infection ICU doctor who really
Mm-hmm.
have to like climb up and sometimes have to resuscitate CPR these patients. But she
Okay.
was brilliant. So she had her special chair and she had a special stool where she could support and get to the level of the patient. So I think we definitely can accommodate special able people in medicine.
Yeah.
Um,
So were all these trainings given to them? Like if you compare to the Indian education system and the US education system, so what all things the Indian education system needs to improve to like make
I
specially
think
able chief? Yeah,
Yes.
you go ahead.
I think there's a lot of quota, right? General quota, OBC quota, this. I think there should be a special, able people's quota as well, because
Right.
the brain is functioning very well, and there are a lot of streams in medicine where you might not need some of those special things. I mean, it can definitely be a more inclusive medical education system um,
Mm-hmm.
than what it is right now.
Right. I agree with you. So I guess like Karan, you have next question.
Yeah, even and Dr. Manu, the reason we ask these questions for specially abled is we just want to increase the awareness among our audience. Like we are not pro that we know everything. Okay, government provides this. So we ask these questions to every speaker just to know what their thought process is. So even in the previous speaker series with Rishabh, he said the same thing that there are some jobs which may not even require that particular ability for which, like, say if you are an interpreter, so you don't need to like always be running around, so you can just sit in your chair and translate what the other person is saying, as simple as
Similarly,
that.
histology, right?
Mhm.
You just sit in front of the screen and review images. A pathologist,
Mhm.
you sit in a space and review slides. So a lot of
Mhm.
opportunities that way of like special labeled physicians.
Yeah.
Okay, so the next session is more into your career journey. So we learned a lot about your student journey and a little bit about your career journey too. But in your career, like you had a long career, so there would be some defining moment that probably propelled you to choose this career, like, and okay, this is what I want to do. So what was that defining moment for you?
I would say there was a defining moment, Karan. I think it's
Okay.
a lot of moments during your journey which defines
Okay.
where you are right now. And that's what I was telling you. Like, I decided, okay, I love bio. So that's how I
Hmm.
eliminated the stream. Then I went to
Okay.
med school and I was like, I love kids. So I don't want to do pediatrics. Then I went to,
Okay.
I loved, I love ICU. I loved, we have something called emergency medicine. So I love
Hmm.
those. There's a lot of endorphin. There's like all the time activity. But then I started losing patience. So
Okay.
there's a trauma case where a person had, the whole family is crushed. And
Okay.
then you've taken care of a patient for 6 months, and a cancer patient, and then that patient
Hmm.
dies, and I just could not cope up with it. So again, I eliminated some of these streams, and I was like, okay, I love ID
Hmm.
because most of the reasons for getting admitted is because you have fever and you have infections. So I was,
Okay.
chosen. So a lot of defining moments on the way, which has brought me to
Okay.
where I am right now. Yeah.
Okay. And as your career progressed, like from student, from school to college, then from college and in India to college in US. So, how has the definition of success changed for you as your career progressed?
Progress. So I think
Like, what did
uh,
you think of success before, and then what do you think of success now?
now, I think initially success to me was getting into the best med school, best,
Okay.
residency, best, the big names basically.
Okay.
So that was what was, a more established academic institute, getting a good job,
Okay.
higher paying job. Um, but I think, and I'm still quite young when you look at medicine where I am in my career.
Mhm.
Like I've just 3-4 years into practice.
Okay.
But I've almost come to realize that it's just not your pay or that big name
Okay.
which makes you happy. It's it's your peace of mind also. And the second thing is, are you enjoying with your colleagues? Are you really enjoying what you are doing? Like, are you
Hmm.
happy to get up in the morning and say, wow, like it's another day and I'm going to meet another patient, or, like, and more kids, and, so I think a lot of, I think I've become quite mature in regards to, of course, it matters to me what
Okay.
salary I'm getting. I'm not going to say, oh, it doesn't
Hmm.
matter. It
Hmm.
matters, but I think I've also come to realize it's not everything. The name,
Okay.
the brand. And I think what the problem with big brands and big names is, I think there are benefits because it's a already established system and you are like,
Hmm.
you're not part of an experiment. Uh, but what is special about going into not a very well known thing or a very, very well known stream is you get a chance to establish it. So you are one of the,
Okay.
founders. So for example, pediatric infectious diseases is not very well known as a subspecialization in India. So it took me
Okay.
almost a year to make people aware that yes, there's something called, because usually just pediatrician would treat everything,
Hmm.
that they kind of, approached it like, we know everything. But there's definitely, I bring to the table more, because I've been trained in it for 3 years. So of course I'm able to pick up which infection faster, which diagnostic to go about. So I think, that I added that. So if you go into something which is not very well established, then you establish it.
Hmm.
You become a founder
Okay.
member of that stream.
Right.
So yeah.
And you even answered my other question, which was like usually in like when we are students, it's like, okay, I want to go into Google or I want to go into AIMS. And if I don't get there, like my life is like I don't have any future. But
Yeah.
you totally like gave a very good answer that that's not everything. You can still go to any school, just have that passion and be open to learning, and then maybe establish that institution
Look
with
at
you,
you
institution with
guys, right? Look at
you.
you guys. You went to AI Triple E and you established this amazing, chain of events there and fest. So I think it's your community who you meet
Mhm.
there and how you establish new things, and just imagine what you're adding to that institution. So you will
Mhm.
always be remembered. Oh, I introduced this to the organization. I established this. So yeah, just be open to any kind of challenge.
And then picking up from that challenging word, the next question is, what has been the most challenging and the most satisfying experience you have had in your career so far?
So challenging. I think there's a lot of you have to study a lot in medicine. It's like you're like you see your friends who are like earning crazy and partying Saturdays, and so you feel jealous, of course. So that's a challenge, and then staying updated. What are your resources? Where do you need to read from? Finances, right? So if you're planning to study abroad, it comes with a lot of burden, financial burden for you, your family. So that was a challenge. Fortunately, I was supported very well from my parents, so I'm always thankful to them. So those were some of the challenges. Satisfying is I am really grateful to God that um, I worked hard and I was at every point I was able to go ahead. So that was very satisfying, and I think I was very very happy when I cleared. I distinctly can recall when I cleared FMC. The day I cleared
Mhm.
FMC, the day I cleared my American board certification in pediatrics, and I got my degree, and my parents were there. It was like a happy moment. And then when I cleared my this subspecialty American boards. So yeah, those were some of my very satisfying moments.
And then the next thing is, what I had seen, whatever I've interacted today, I've seen that you always had someone to guide you, that maybe your sister or then Dr. Kanitkar. So, as a student, how do you, like, how significant is it for them to have someone to look up to, a mentor or a guide, like who just listens to them, understands, okay, maybe this is what you can do. So, how do you rate the importance of a mentor in a student's life?
Very, very important. I think it's very important to have a mentor in life. And it's not just one mentor in your life. You will
Okay.
have
Okay.
multiple phases. I think one of the biggest mentor for me was my mother and my sister and my
Hmm.
father. And of course, you were a kid basically at that point of time. But you would trouble me in your own ways where I would be reading books. Storybook in my medical books, and you would go and complain to parents, and then I'll probably be focusing it back on medicine. So there are a lot of mentors you will encounter, and with every stream and where you want to go, you'll find a new mentor. But you need to find that
Okay.
mentor. They can be your family members. They can be your who have already family members who have already been through that stream. They can be
Hmm.
your friends, senior friends. So for my college friends, like I'm still very close with them, who have always guided me. Okay, this is a good idea. This is not a good idea. So your seniors can be your mentors, and then your professors, right? So just find one person who you confide in, who you think kind of understand you, share what you want in your life, because sometimes you don't know how, like, which way to take. And I think that's what you guys are
Hmm.
trying to do through Vidya 5. So find those mentors and route. You can do your own search as well online, like you have like amazing Google search for things. In US they have a lot of counselors, and I think there are a lot of counseling services which has come up in India as well. So avail those. I think it's quite important. So find various mentors during your journey of life.
Yeah,
Thank you.
that's great. So moving on to our next segment, so it is like more about your personal life. So tell us about, like, because being a being in Indian community, like being a girl child, so many of the parents do not give that freedom and like to pursue this career, to pursue that career. So how was the support of your family in building up your career?
Oh my God, it was amazing. So my dad is super hardworking. He would get up at 4 for us, 4 a.m. in the morning, and he would do all my, like, he'll give me exam MCQs, he would write and then check them up for me. He was a great support. Then, I've never felt like this whole feminism concept was very, very weird. I was like, why? Like, like, I never felt uh, biased in my family, and we were always treated equal, like all extended families as well. Actually, it was so funny that Karan one day, he came up to my parents and he's like, in all households, it's the boys who are like really like, given so much of importance. But this is the only household where girls are getting more importance. So it was actually very, very, my parents were very open and they were very supportive. So I'm really thankful, and it really matters, what kind of support you get. My mom was always available. She was a teacher, and after 2 or 3 she would be there when we are studying, and she would go to give us snacks and keep us happy, so yeah, it's a your family support is a huge support.
You gave us a very nice message, like to all our listeners. Like, if any of the parents are listening, I'll again say that, like, to follow the family of Mr. Karandeep Singh and Dr. Manu Chaudhary. So that would be a
Like,
great
Karen will
example.
not excuse it.
Okay, tell us about what do you do in your free time?
So I love to read. There was a time when I was was not able to read that much, especially in med school. So now that I'm a little more settled in my life, I get to read books, listen to audibles when and podcasts when I'm driving to work. I love traveling and getting to know new cultures, and so is my husband. We love nature, so we go for small hikes. When I was in US, Karan was also there, so we would also go out and visit new places and check out new cultures. And I love family time, like because we all are so, like, segregated all over the world. Like, Karan, my
Mhm.
sister are in US, my mom and dad are in Delhi. Me and my husband are here in Bangalore. My most of friends are in Delhi and US. So whenever we get time, free time, when we are visiting family, I think I just love it. So yeah, those are some of the things I do for my free
So, what
time.
about the passion of your sports and acting?
Absolutely. So acting not doing anymore, but because my husband is also quite active, so we try to learn one new sport every year. So this year we learned badminton. And yeah, so we try to learn one sport every year, and this is the year of badminton.
We
Because
have
of
an
all
all-rounder over
this,
here.
COVID has really, like, put us off. I
This
think
is like just for being like maybe a year or so. Like, we will be.
Yeah. So the next one is pretty easy, but you have to give very quick answers. So it's a rapid fire round. So very you don't have to think a lot. So you have to immediately give the answers. So the first one is, who is your idol in your field?
in my field, I think I would say Dr. Kanetkar
Okay. Then what if
and Dr.
you were not in the
Baker.
sorry?
She's an Dr. Baker, Dr. Kanetkar and Dr. Baker.
Okay.
Very, like, first ladies leading med school and established themselves very
Okay.
well. Yeah.
Okay. So are you a morning person or a night person?
I used to be morning, now I'm night.
Okay. Describe yourself in just 3 words.
I'm happy. I love kids.
Mhm.
Uh, I love my family. I think it doesn't
Uh,
describe
those are
me.
s-
Okay.
those are 3 sentences and not 3 words. So this is like entirely wrong.
Cheerful. I'm cheerful,
Mhm.
dedicated, and
Mm-hmm.
strong head.
Okay, cool. And what is your favorite quote in life?
Where there is a will, there is a way.
Okay.
So nice.
And then what is the lowest grade you have ever been given, and which class was it for?
Oh my God. So I think I was in fourth grade and I stood like sixth in my class. I think that was this time.
Okay.
Yeah.
So thank you so much for the session. It was, I think it was very informative, and especially knowing you personally and then doing this was even a new experience for me because I have not seen this part of your life where we are interacting on a formal basis. And I think viewers, be it the students or the parents, they would get a lot of content from this particular speaker series. Kashish, you want to say anything else?
Yeah, definitely. It was such an informative session. So to wrap up our session, I would like you to tell that one special message, one single message which you want to tell our audience and the listeners.
Sure, sure. No, thanks for having me here, guys. I think the message is if you want to be a doctor, be prepared because it's a long journey, but it's very gratifying. Like my every day is full of, there's instant gratification when you see your patient recovering, your patient's parents being happy. So if that's the kind of thing you want for your life, instant gratification, go for it. It's a very satisfying, but it requires a lot of dedication. um, One thing I would have done different would be I would have been more focused on my internship, because people who go
Okay.
want to study abroad, they kind of skip some part of their internship. So people who after seeing this decide to go to US, please do not skip any part of your medical education. So
Okay.
study well, and and you can reach us through Vidyafy. I'll leave my email. If people have specific questions, we can answer them in the comments or through via email. So
Yeah,
good
that was
luck.
such a wonderful session with you.
Yeah.
So I know that like for our listeners and the viewers, like there are many more questions which you wanted to ask us or Dr. Manu Chaudhary as well. So do write us at our email ID vidyafy.org@gmail.com over here. So thank you so much, Dr. Manu Chaudhary, to be part of our speaker series session. We are extremely honored to have you as our guest. Like it was such a wonderful session with you. Thank you so much, Manu Chaudhary.
Thank you, guys.
Thank
Thanks.
you. Thank
Yeah.
you.